From the California Healthcare Foundation, and I'd like to welcome you to our last California Improvement Network webinar of 2011. The title of today's presentation is The Patient Voice, Simple Feedback to Improve Care. And I think we're going to hear some really interesting stories today. A little bit of webinar etiquette and housekeeping. We are going to be recording this session so that folks who are unable to join the call will be able to listen in later. It will be posted along with the PDF of the slides, probably within the next few days to week. Just a reminder to reduce distractions and background noise. Please send your calls to voicemail, silence those ringers, close those other apps. And please remember not to put us on hold, because even though we'd love to hear all that holiday music, I'm not sure we want to do it during the presentations. And at this point, we may put all of the lines on mute for those listening. And we will, however, give you a chance to ask questions in the following ways. One is you can, any logistic questions, you can chat to the host if you're having trouble getting on. If for questions to the speakers, you should be posting them in the chat box to all participants. And you can also, as long as you see a little phone next to your name, you can raise your hand. You right-click on yourself, and you are actually at the bottom of the, kind of in the middle of that right-hand column, you'll see a hand that you can raise. And when you hover over it, it says Raise Hand. Sometimes people call in using a different number and did not have the system call them on their current line, in which case I cannot unmute you because you don't have an actual phone line associated with your name, and so you'd have to ask your question through the chat box. So I hope this makes sense. Let me introduce today's speakers. I'm actually going to do them in reverse order. Kimberly Petty is the Senior Director of Experience Design and Solutions at Experia Health and brings her expertise in process improvement, innovation, and customer loyalty to enable healthcare organizations to rapidly transform their patient and family experience. Prior to joining Experia Health, Kim formed Value Genesis, which is a strategic healthcare consulting business where she worked with major hospital systems, senior housing companies, and businesses serving healthcare to develop long-term strategic plans and deploy customer experience programs. Kim spent over 9 years with General Electric, where she had most recently served as Vice President of Customer Programs at GE's Healthcare Financial Services business. And in that capacity, she delivered programs in talent development, process improvement, and strategic planning to companies in the healthcare industry. And there led the Net Promoter Score customer loyalty efforts and supported new product innovation. So you'll hear a lot more about the NPS in a moment. Kim's work with healthcare organizations has delivered dramatic improvements in satisfaction scores and marked improvement in market share. As a certified Lean Six Sigma Master Black Belt, she has executed many large process improvement projects, reducing cycle times and inefficiencies that drive dissatisfaction. Kim holds a BBA in Management Information Systems and International Business from Ohio University and an MBA from the University of Chicago Booth School of Business, where she studied organizational behavior, entrepreneurship, and marketing. So as you can hear, she has very deep experience in the whole patient and customer space, and it's exciting to hear more from her. So Kevin Gwin is the Vice President of Communications at Ardent Health Services. He has 25 years of communication, marketing, and media experience and leads the patient experience initiatives for Ardent Health Services, which is a $2 billion hospital and healthcare company based in Nashville, Tennessee. Kevin is a certified Net Promoter Associate and uses Net Promoter Score and HCAHPS, otherwise known as the Hospital Care Quality Information from the Consumer Perspective Survey, to measure and develop patient and customer loyalty for Ardent hospitals, health plan, clinics, labs, and pharmacies. His healthcare experience includes urban and suburban multi-hospital systems and small rural hospitals, as well as investor-owned hospital companies and Catholic not-for-profit systems, so he's kind of covered the entire territory there. Previous to healthcare, Kevin held a number of senior executive communication positions at a top 25 bank holding company, the third largest international insurance broker, and Nissan Motor Manufacturing. He has also experience in PR and advertising agencies and the television news media, so he'll probably have a better communications voice than I. Kevin holds a bachelor's degree in journalism from Abilene Christian University in Abilene, Texas, and he is a member of the Federation of American Hospitals. So I'm actually going to hand the presenter ball over to Kim so that she can drive the slides and start us off this afternoon.
Thanks so much for that introduction, Sophia. We wanted to spend some time today talking to everybody a little bit about a customer loyalty measure called Net Promoter Score, and just we'll dive into it a little bit deeper and a little additional background. This is a program that I was first introduced to at General Electric Company, where I ran the program, and we spent some time doing this at the Cleveland Clinic and have now seeing this as a trend in healthcare, and Kevin will be able to share some rich experience around that. But what Net Promoter Score is it's a methodology founded by Bain and Harvard Business School. They've done about 20 years of research now on this methodology and have identified it as the question that they ask through Net Promoter Score has the greatest correlation to individuals' intent to repurchase across industries, and they've also shown it's highly correlated to growth. So the question they're asking is one that you've all seen. It's how likely are you to recommend XYZ to a friend or colleague? But they've been able to demonstrate through years of research across industries and across many different customer bases that this has a huge impact. If you are doing well on this customer, this is the indicator of whether people are going to come back to you as an organization. So how is it being used in healthcare? There are several organizations who have actually engaged in using Net Promoter Score. Cancer Treatment Center of America is actually featured in Fred Held's book, The Ultimate Question, for their use of Net Promoter Score. North Shore and Ascension Health. Ascension Health is a 70-hospital system. Cancer Treatment Center of America has about 5 hospitals. And then who we have on the phone today with Kevin Gwin and Ardent Health Services has 2 different healthcare systems, Lovelace and Hillcrest, and he'll dive into that a little bit more. But they're using Net Promoter Score across their hospitals, clinics, and pharmacy base. The premise of Net Promoter Score is really about what is the word of mouth that is created when you create either a good experience or a bad experience for the patients we serve in this case. And that those individuals who have a great experience tend to tell 3 others, and those who have a poor experience tend to tell 9 others. So there's this amplifying effect. And if you look at the prevalence of different social media technologies today, this is becoming even further exacerbated. You know, I don't know how many of you have gone onto Yelp or City Search or any of these other social media outlets where people do ratings, but you can see often comments about your clinic or hospital or whatever provider setting you're in. And so it's becoming even more essential that we pay attention to the voice of our patients and families that we serve and identify how we can address the issues that they're raising. So how do we determine Net Promoter Score? So like I said earlier, Net Promoter Score is a pretty simple question. They ask on a scale of 0 to 10, how willing would you be to recommend company X to a friend or colleague? And anybody, the way that the score is calculated is that anybody who gives a rating of a 0 to 6, they classify them as what they call detractors, meaning people who would probably actively speak out against you in the community. Anybody who provides a score of 9 or 10 is considered a promoter. So these are the people who are vocally, tooting your organizational horn. And then in the middle with the 7 or 8, they classify them as passive individuals. And the Net Promoter Score is calculated by subtracting that percentage of promoters minus the percentage of detractors. So, and you can see scores. I think one of the highest Net Promoter Scores on record was actually recorded for Cancer Treatment Centers of America. They've done some really great things with the tool. And then there are some organizations who have more detractors than promoters, so they have a negative Net Promoter Score. So it has a broad range, and there's a high opportunity for improvement when you look at this correlation between this and growth. The other thing to emphasize here is we all have a tendency as human beings, and even in our personal development and professional development, to really quickly, and for those of you who are collecting any sort of customer or patient feedback today, probably do this to some extent, that we have a tendency to focus on those people who would, in this case, fall into the detractor bucket and think about all of the things that we're doing wrong. There's a huge opportunity to actually think a little bit more deeply about this promoter bucket, or those people who are singing our praises today, and finding out what is it that's driving them. If you're using either the HCAHPS or CGCAHPS CMS patient satisfaction surveys, we tend to try to figure out what it is that is driving people in the bottom box, as the case may be, as opposed to really focusing on what are the things we're doing great for those people in the top box. So the big piece here is we tend to talk a lot about satisfaction whenever we're doing any sort of survey to collect feedback from patients and families. But what Net Promoter Score is driving at is what we would say is loyalty. So how do you get people beyond just satisfaction as you're doing what is expected of me to some extent? You know, it's the green fees, versus what you really want to create with the patients and families you serve is a feeling of loyalty where they feel a connection and a true relationship to your providers, to people within your organization, and your organization as a whole. So just to dive a little bit more deeply into what are the drivers of Net Promoter Score in the organizations who have done this really well in healthcare. Ascension Health, as I mentioned earlier, has a really robust Net Promoter Score program. They've been doing this for at least 5 years. And they've taken and analyzed what is it that leads people to either promote, you know, be a promoter in that 9 or 10 bucket, or a detractor in the lower bucket. And what they've seen is it's not about what many of us tend to focus on. It's not about the efficiency. It's not about clinical quality. We have a tendency to, it's amazing in the work that we do at Experia Health how often people want to focus on the physical environment, and if we just had a nicer hospital, then we would have better satisfaction. What you see is actually what's important to patients and families is whether they feel emotional support and fulfillment. It's the drivers for Ascension. It's communication empowerment. It's the care responsiveness. It's compassionate and respectful care. And we see similarly, Bain did a study across 3 different hospitals using Net Promoter Score. This is a little bit of a complex chart, but what it's showing is that the promoter, the people who have an attachment and loyalty to the organization, are choosing not based on clinical reputation or facilities, but on these emotional elements. And the people who are detractors, or who have had a bad experience in organizations, do tend to cite some of these clinical or physical things a little more often. But what is really happening, what you see actually as an opportunity, is if you can address these emotional and spiritual needs, the responsiveness, the communication, that these other things can be easily overlooked. And lastly, this is consistent, and many of you are either using probably CGCAHPS or HCAHPS for your patient satisfaction measurement system today, because we've got the government mandating it. But similarly, we see that the drivers of the overall and the willingness to recommend scores on the HCAHPS survey are also in the same bucket of this emotional and spiritual fulfillment, with drivers being things like communication with my doctor and my nurse, and responsiveness being the top indicators of whether you are going to be successful in improving those overall scores. So just to give a little broader perspective outside of healthcare, this is probably the #1 most commonly used and really rapidly being adopted measurement system for customer satisfaction across industries. And the reason why people have been really captivated and pulled into this is because they've been able to show that with years of research how this question and this tool is correlated to organizational growth and profitability. So what you see on this chart is, two different charts. One that's talking about the airline industry, and an industry we've all had probably some interesting experiences with, and they've been able to show that those organizations that have really high Net Promoter Scores within the airline industry have far outpaced their competition in terms of their growth year over year. And similarly, there's this other chart is showing that in the telecom industry. So that is really why people have latched onto this across the country, why you see big organizations like Apple and General Electric and some of the major brands out there in the world are using this as a tool to measure their customer satisfaction today. So what's important, we've talked now just to give you a broad landscape of the measurement system, but it's one thing to have a measurement system and it's an entirely different thing to do something about it. So wanted to give you just a quick example from Ascension of their Net Promoter Score action plan, because if you can have all the data in the world, but if you don't have the tools and the resources and the capability to do anything about it, it really loses all of its meaning. So what Ascension is doing is really starting with staff empowerment and enabling the people on the front line to take action to make changes. They've got a couple different toolkits you see listed in the bullets here, like Lean Six Sigma and adaptive design that they're using to accomplish this. Many of the organizations we work with, we use a methodology called experience mapping, which also leverages sort of Lean Six Sigma as a foundation, but making it so that the individuals in your organization feel like they have the power to contribute and make change where they see something wrong is being a fundamental piece of this action plan. The next piece in Ascension is how they're offering emotional and spiritual support. Again, they've got some holistic care programs, which are part of their core set of values and some of the things that they're doing around their leadership development. One of the things we did in this space at the Cleveland Clinic and are taken to many other organizations are programs like healing services, where instead of just when you come in for open heart surgery, you have your consult with your surgeon and then you go in under the knife, how do you make it so that you have proactive engagement of these resources that we have often in our organizations to provide emotional and spiritual support, things like pastoral care and social work, or even hospice care that are often called in after an issue occurs and when it's become too late to really help address these needs. How do we be more proactive about providing some of that to the patients and families that we serve? And then this third element, the real-time closed-loop feedback, in Ascension, they're using post-discharge calls and rounding. There are some really cool technologies we've seen out in the market, and Kevin will talk a little bit about some of the technology he's been using, but that enable you to do a really effective job of actually not just receiving this feedback, but going back and acting on it, and rapidly being responsive to the needs of the patients and families that you serve. And then the last piece is of their action plan is around aligning their people. a lot of this can become meaningless if you can have the most robust customer satisfaction program or patient satisfaction program in the world, but if you don't link it back to your organizational values, to your hiring philosophy and the people that you're bringing into your organization, it can quickly lose its meaning. So, you know, what we often call a set of how do you create that always versus never standards of behavior within your organization so everybody realizes that it is part of their job to own the experience. So just quickly, a little bit on how do you actually deploy this tool if you chose to do so within your organization. And this gets a little bit tricky in healthcare just because of the regulations we're up against. So one is, you know, the studies of this show that really you only have to ask 5 or fewer questions. We have a tendency when we deploy surveys to patients and families to ask 25, 30 questions, and the government mandated surveys often fall into that line. The advice here is that you really need to ask just a handful of questions. How likely are you to recommend us, and why? And if we could do one thing, what should it be? You know, just keeping it really short and succinct. I have a tendency to think that the reason why we ask 30 questions on a survey is simply because it makes it easier for statisticians to analyze the results. And you lose, when you ask so many questions, you have a tendency to lose the verbatim comments that are often the most powerful and actionable piece of the surveys that we can do with our patients and families. The second piece is, you know, around getting enough sample size to make it meaningful without overwhelming your organization. It's often that we see in the organizations we work with, you can walk in. This is important because you can walk into a physician. We often have physicians who say, you know, they're reporting this data to me at a physician level, and I have a total number of surveys that they've received of 4, and that's really not meaningful to me in terms of its relevance as a sample size. And this only captures, you know, but what happens is I get 1 complaint in this survey, and I'm getting a call from my CEO or somebody in administration saying, what did you do here? It doesn't take into account the fact that I get thousands of, you know, or hundreds of thank you cards and personal thank yous from my patients every year outside of this process. So this isn't just about having statistically significant data, but it's also a little bit about how you utilize it within your organization. The third element here is just about having a process for following up and understanding root causes. So we often get a sort of glimpse through surveys into what is going on within the experience of our patients and families, but to really understand at a deeper level the root causes, it's often helpful to either follow up with people who you've surveyed for more in-depth phone interviews or to hold some focus groups if you start noticing certain trends in the data that you receive. The next piece is really around using the data to really understand wing-to-wing what's going on in your process. And we often talk about this as mapping the gaps in the experience. But how do you use it to understand the opportunities to really simplify things for patients and families, but also understand where are those emotional gaps and those opportunities to create connection that we're missing today. And then the last 2 points are about, I think, kind of fall a little bit into the same bucket for me and around how do you leverage promoters and integrate this with your existing operations. So Cancer Treatment Centers of America and the work that I've done some work with them, and they had some really powerful ways they use this data in terms of every board member started with a patient or a family, or board meeting started with a patient or family telling them a story about their personal experience that they either, you know, and not just the good, not just the bad, you know, a little bit of both, so that they were able to recognize the people within their organization who were really bringing their core values to the table. And they actually interestingly asked the question as how likely are you to recommend Cancer Treatment Centers of America to your mother? Because they do everything based on the mother standard. The organization was actually founded because the founder lost his mother to cancer, and he didn't feel that she had the opportunity to have every option possible available to her. So their whole organization has this mother standard. They integrate it with how they deploy Net Promoter Score, and they have this really core connection to the patients and families that they serve. The last piece, just sort of on the operational side of this, and then I'm going to turn over to Kevin Gwin to give you a little bit more of the nuts and bolts of how it looks in reality within his organization. Is just to kind of give a quick word of caution on common errors. And this is challenging a little bit, but one, we have a tendency to be unwilling to let go of past feedback systems. So, you know, if there's already a survey you're using, we have a tendency to just want to slap this question onto the end of it, as opposed to redesigning the survey and starting from scratch. Now, Kevin already noted to me before we started this that part of the challenge with this is that we have in healthcare started to have some mandatory patient satisfaction surveys. So, and sometimes we're not able to get around this one, but if you are able to, ideally, and the nice thing about if you're doing this with an outpatient population or in a pharmacy setting, you still have a little more flexibility because we haven't been mandated to measure in those spaces. But you want to be able to really keep this following the last slide to that 5-question simple survey as opposed to having to bolt this onto some other existing feedback system that hasn't necessarily been successful. The next piece, I talked a little bit earlier about, you know, we have an emphasis in it just naturally as human beings to want to focus on what we're doing poorly. And often, as a result, lose sight of what is it that we're doing excellently and how can we actually scale and spread that throughout our organizations. The all measurement, no action, I think we hit on that as we walked through that ascension plan. Failure to gather input on solutions is an important one. We have resources within our organization. You have people out there, boots on the ground, in the front lines, that have ideas, they have opportunities and solutions, and if they just had the opportunity to participate if you create a forum for individuals, both from your multidisciplinary team and from patients and families, to be part of the solution and to develop what the solution can look like, it's amazingly powerful. And the amount of engagement you can and commitment you can get from your staff to improving the experience is wonderful. Then the last couple pieces, one is failing to integrate this with operations. So if this is just something that's happening on the fringe or the side, it's never going to get the attention that it deserves. What we've seen just with patient experience across the nation is that it's often sort of relegated as fluff, and shame on us, it's changing a little bit because we're starting to link reimbursement to it in healthcare, but it used to be that at the C-level or the level of administration within our organizations, it was really difficult to get attention for this because it was competing with financial results and quality. But if this isn't part of the agenda for your board of governance or whatever that leadership forum is, your leadership team isn't part of your staff huddles, then it's really never going to get the momentum that you need to really start seeing successful improvement. And then lastly, many organizations have a desire to link this to compensation and incentive plans. And it's an excellent tool to really help drive ownership for the metrics, but it's really important to consider a variety of things. One, just your organizational readiness. If this is the first time you're measuring this and people don't understand the system and all of a sudden their compensation is linked to it, that can be a bit disruptive. You have to wait till your organization is mature enough to handle that. but also it can tend to lead to a little bit of bias as opposed in how their data is handled. I think many of us have probably bought a car and received or been through something where they've been told afterwards, you're going to receive a survey, please say something nice about me in it. And that's something you want to just avoid as an opportunity. So that's just, I wanted to give a little bit of just an operational overview and background of the tools from a technical perspective, but then really turn it over to Kevin Gwin from Ardent, and he'll talk a little bit about background on his organization. But I just want to say, you know, in addition to the introduction that Sophia gave, I've had the privilege of working with Kevin over the past a little over a year. And, you know, as an individual, he's really connected to purpose and has such a passion for this work and has a really complex landscape of just as he goes through this, of having to deploy this, so can give you some really rich insights into the complexities of how this looks as you operationalize it across a complex health system. So, Kevin, mic is yours.
Thank you, Kim. Let me just say that when we sit around here at the corporate office, and I spend a lot of my time in the hospitals, but in our executive level meetings, NPS is the metric, one of the main metrics that we're focusing on. So it's that important to us, and it's just the right way to treat people, and it's a good measurement. Loyalty is a better measurement than satisfaction. So we've found it to be a very key metric for us. Okay, so who are we? We have these two systems, one in Tulsa, one in Albuquerque. In Tulsa, we have the hospitals and the physicians. So we have that model. You see the 55 clinics, the 30% market share, the 6 hospitals. We're fairly dominant in that market. In Albuquerque, we have the hospitals and we have the health plan, and we contract with physicians there. So the model's a little different. Nearly the same market share. We're number 2. We also have a lab system and pharmacies. So when we look at NPS, executing it in the hospitals, very different than doing it in the clinics and in the pharmacies and the lab, and we're going to talk a little bit. We use different measurement tools. We use them more frequently in one area than the other, and obviously we go about moving the score in different ways as well. Why NPS? Well, we believe in it. We believe that if you can grow loyalty, you're going to grow market share, and you're going to make a better emotional connection with your customer, with your patient. And it's really about culture and being able to connect with your customer. That is the key. So the voice of the customer is a powerful way to motivate and to change things. We have found that NPS moves out in front of HCAHPS on the hospital side and value-based purchasing. So we're looking at our NPS every week, and we have a good feel for where we're going to be on HCAHPS at the end of the quarter or even at the end of the month. So you're managing one number, and if you're experienced with how HCAHPS works and other CAHPS surveys work, you're managing multiple themes and multiple questions within a theme. So it's a little more difficult to get your arms around it. NPS, we know it's a leading indicator. We know the two correlate very strongly. We can manage one number. We still very much pay attention to HCAHPS, but if we're going to choose the two, we know if we can drive NPS up, that everything else will come along beside it. So how do we do this? Let's first talk about our hospitals. We break Kim's first rule, and we bolt it on the back of HCAHPS. So we went to our HCAHPS survey, and CMS requires that you ask a number of questions. We knocked every question they did not require out of there. Totally eliminated all those other questions. I was surprised when I went to look at that survey. We had HCAHPS, we had a bunch of dietary questions. We were asking things about the facility. Went ahead and blew all those up. We're going to ask HCAPs, and we're going to ask our 3 NPS questions. The would you recommend? Why did you give us that score? What can we do to improve? The last 2 verbatim, and you can learn a lot, both positively and negatively, about from those verbatim comments. We push the NPS score out every week, and I have the scores on a future slide, so we're going to look at those. So weekly updates to a monthly score, and I'm tracking my score by discharge date. So it accurately reflects what's going on in the hospital or in the outpatient or in the ED or in the clinic at the time. If you do the HCAPS timeline, then you're looking at the quarter as a whole, and it's hard to know, well, was that an October thing or was that a November thing? When I look at it monthly, I know that my October score reflects the patients who are in my hospital in October, and so on. We do contract detractors. While we don't overly emphasize their opinions, we believe that we need to do some service recovery there. We need to apologize for how they believe they were treated, and we need to learn more about what were the root causes. What did they really see there? What was it that really ticked them off? So we can coach our staff, and we use their voice. We use their exact words, whether it's on paper or in one of our hospitals. We actually have a person read aloud to a unit, a nursing unit, the comments from that nursing unit. So they can hear it, they can actually hear a voice. And it just, I think it's more motivating that way. And then we use our promoters as focus groups. Like we'll have a section of the hospital that is just not going over well with patients, and we'll bring in promoters who love us already and who are eager to give us feedback and make us even better. And we'll have them come into that section of the hospital and help us. How should this be designed? Why are these rooms continuing to come up not clean? Help us over here. Or what are we not thinking of? What's our next big thing that we need to do? So we're using our promoters to help drive where we want to go next. Here's an example of that. In Albuquerque, we have these hospitals across town. A lot of the young folks live on the west side of Albuquerque. We didn't deliver babies over there. We delivered babies at our women's hospital, which was on the northeast side. We didn't think it was a big deal that people had to drive across the river. It wasn't really that far, 15, 20 minutes. But those focus groups of promoters educated us that if we would even have a small labor and delivery unit, that they may not use it every time, but they're more apt to try us for other things. So we went ahead and created a birthing center on the west side. It's been very successful, and I credit that to our promoters helping correct a misperception we had of their willingness to drive across the river. On our ambulatory side, our pharmacy and labs and clinics, we're using a wireless device that I'm going to show you a photo of here in just a minute. And we're getting scores from that wireless device every week. We could get them every night, which just think how powerful it is to get a score every morning, and you can tie it directly to what happened yesterday. Boy, we were short some people yesterday, or the computer system went down, or we got a big rush in our pharmacy at 3:15. So the more information we have, the better we're able to manage it, and the better we're able to align our business to our customers' wants and desires. Right now, at our point of service, our outpatient and pharmacy and labs and clinics, NPS is anonymous. We're going to get to the point, so we're going to take that wireless device and we're going to scan a barcode, so we'll actually be able to focus a score to a patient. And that way, just like you do when you go into an Apple store and you swipe your card, they know that, okay, this person has bought a couple of iPhones, they have an iMac, now here comes their iPad 2. So they know a little bit more about you, and we'll be able to do that with those patients as well. So here are our scores. I consolidated all of them. And this is our Nps scores for our hospitals. So this is 8 hospitals. We have just acquired 2 more in Tulsa, and they're not quite online yet. But this is 8 hospitals in 2 markets, average Nps, again by discharge date. And you see the number is making headway, but slow. It's slow progress. The reality is, in our smaller systems, we're seeing significant progress. And in our larger systems, it's just harder to move that metal. Size matters, as I was saying. Look at our 2 larger facilities. Hillcrest in downtown Tulsa is about 700 beds. Loveless Medical Center, downtown Albuquerque, New Mexico, is 260 beds. And our scores, even though I think on Kim's slide you saw where Southwest Airlines was doing the best out of the airlines and they were in the 50s, we're doing a 67 last month at Hillcrest, and we know we can do better than that. So that is not a good score for us. And a 72 at Loveless. We know our other hospitals in Albuquerque are doing better. So we feel like we have more improvement to get out of the larger ones. Look at my smaller facilities. Bailey is 73 beds. Cushing is about 120 beds. Loveless Westside is less than 100. Loveless Women's is 120. The smaller the facility, the easier it is to develop better culture, better communications, get everybody on the same page. So what this has taught us is we're breaking down those larger facilities and looking at them by health service line and looking at them by floor and looking at them by unit. So we're tackling them unit by unit, knowing that we can affect change quickly in smaller environments. So we're tackling those larger facilities and breaking them up into smaller hospitals, if you will, and making good change that way. All right, here's our device. That is not my cover. What I do with my cover is I brand it specifically to the Loveless Pharmacy and to SED Medical Labs. So I use this little tablet-like device. It's not going to be stolen because it's cheap. It's a little plastic and a little plastic cover. And I ask 2 questions for mine. I ask the would you recommend, and I asked where do we let you down? So they hit a couple of buttons and hand it back, and it automatically is submitted. And then overnight, all that information goes to Dallas. It gets analyzed overnight, and then I get it every week, but I could get it every morning. And then what we do is we push it out, and we have a huddle on Monday mornings in those pharmacies and labs, and we look at those numbers, and we talk about, and we let the frontline staff tell us, you know, how do we think this happened, good and bad? Where do we think, where do we drop the ball? What did we do really well? What can we do today? So before we open the store, we already got a sense of how well we've done the previous week or the previous day and how we're going to attack today. And it's been real powerful for our folks there to actually see how something that happened last week or yesterday can impact the way, the loyalty of our customers. And it's been easier to get them on board because the information, we close that loop so quickly. So let's look at our early results. And I know you're thinking, Kevin, you should be really happy about this. Look, you know, you're getting a 98 NPS. Our response rates are so weak that I'm not believing that result. So yeah, I'm glad we've got a nearly perfect loyalty, but my response rate is less than 10% on some days. I think my best day has been in the 20s. So tiny response rates. I'm not ready to believe the data because I know that in other places where this device is used, the response rate has been more than 50, 60%. So I want us to get up there. So right now we're focusing in those shops on response rate. We're not focusing on what the loyalty score is yet. I have a lot of variation in execution. I'm not consistently executing every single day. So some days we're on, some days nobody's touching the device. My pilots have showed me that I got to have Spanish language, so we're doing an overlay where you can just flip the cover and we can go from Spanish to English pretty quickly. But just even with our weak response rates, we're learning that our wait times in some of our key pharmacies are way too long, and that we struggle with being friendly in our labs. And it's just because our people are really busy. And the scores are having a lot of impact on pointing that out to our staff. And it's better for the customer to point it out than it is for me to come in as an outsider or for a manager. Now the voice of the customer has its own power, and it can motivate and impact change more effectively than I can. What are our next steps? We're going to continue to do this in our hospitals. I'm growing my sample sizes to right now I have a margin of error of about 5%. I want to get it a little smaller than that and get even some more volume coming in. We're going to be doing it next month in our clinics, and we've just worked out how we're going to do that. And again, we're going to focus on response rates, and we're not going to worry exactly who the patient is. We're going to get those response rates out, and then as we get the process down and are consistent, then we're going to scan the barcode and be able to connect it to specific patients. So we'll be able to tell that Sally so-and-so has been a promoter for us for the last year, or that she's been a detractor. And so we'll know before we walk into that exam room where our customers are. And it's what Southwest Airlines and Four Seasons Results and American Express and Apple are doing, and we're going to be doing that too. At Westside Hospital, we're going to shift from satisfaction in our outpatient and ED area, and are going to use NPS and begin measuring loyalty. So we're going to blow up those old surveys, and we're going to focus exclusively on NPS, and we'll do it in those two areas. And then we'll do it at Westside. I have a great culture there and high employee engagement, and I'm going to take that. They're early adopters anyway, and we're going to go ahead and launch that at Westside, and then we'll roll it out to some of our other hospitals. And I don't know, Kim, if you want me to talk about this or if you want to talk about this last slide for us.
Yeah, I mean, I think that, well, and we've also had a few questions come through, I see on chat from Sarah Porter. One was, and Kevin, maybe you want to jump in and help answer some of these, is how receptive have you found customers to root cause or phone follow-up on their initial surveys?
We've had very few that have not wanted to tell us more, both on the promoter side and on the detractor side. The detractors are eager to tell us where we screwed up, and they want to hear our apology, and they feel good that we at least heard them and are making an effort to change things. And our promoter side, they love us. So they're eager to give us feedback and make us even better.
Yeah, and I would second that. We've had similar experiences with all the different hospitals that we've worked with, and I think even more powerful, there's generally a pretty good willingness to participate in a telephone follow-up or an interview. And often that's a good venue to figure out how you can even engage people at a deeper level, whether that be for a focus group, or what we often are able to do is bring people in, sort of as Kevin talked about, for design sessions to have these people, whether they be detractors or promoters, involved in helping to work with alongside your front line to identify what are the solutions and shape them and be part of it, which is a really cool way to engage those individuals. And then I think the second question, also from Sarah, was on integrating this at all levels of the organization, and how do you sell this to your front line so that they're bought into it. And it sounds like what you're doing there, Sarah, is reminding people why they went into healthcare and creating a better work environment. I have not found in our experience that this is that tough of a sell to the front line, that they're really eager to hear from their patients and families what they think. Now, the bigger challenge I see is how you position that. Some organizations tend to be overemphasize the negative or oversensitize the quantitative results of these surveys, where you have to share both positive and negative feedback so that people can identify opportunities for improvement. But also what I find the front lines really grab onto is not the number, but actually those verbatim comments, whether those be about individuals or what they're doing, really can be compelling and remind them of the purpose and why they've gotten into healthcare. And then it's not just sharing it, but giving them an opportunity to be engaged in part of the solution again. Kevin, I don't know if you want to speak to that a little bit too.
Yeah, you got to love it when your customer is mentioning the nurses by name and the doctors by name. So as we push these comments to the frontline staff, they're talking about people they know, and they're talking about them. So, you know, we didn't change the size of our name tags, but we increased the font of that first name, and we're seeing a lot of names come through on those verbatim comments. So that's number one. And I think we're just tapping into the heart of the servant heart that a lot of our people have. They want to connect. They want to do better. And there's been some instances where we have found out that we didn't quite get the type of person that we need. You know, as healthcare becomes more retail and as there's more public scrutiny and it's tied to reimbursement, customer service is going to be more important. Quality will always be the most important, but here comes service, and we're going to have to do a good job at both. So we have had to regrettably make some changes with some folks who were competent on the clinical quality, but for some reason couldn't emotionally connect, or at least make people feel good about having them in their care. And Net Promoter kind of shines a light on that, and it allows us to target coach. And in some extreme cases, we can make a change because we can tell it's just not happening.
This is Sophia. I have another question to add into the mix, which is, Kevin, you mentioned that you're going to or are starting to launch the NPS in Spanish, and I was wondering from both of you, what do you know of the experience in using the NPS across different cultures, and if there are differences both in response rates in terms of even wanting to provide the feedback, as well as any potential biases that might be seen in terms of how the scores are scored?
I think that's a really good question, Sophia, and I honestly, I probably can't completely speak to it because I do think that there's just different ways that different cultures perceive providing this type of feedback and whether they're truly direct. But I do think one element of that is the mode in which you deploy the survey. You know, obviously you can do all sorts of studies on different types of survey bias, but providing anonymity and making sure that this is done in a safe environment. So even with the tool that Kevin shared, you'd have to be really careful if you're using that technology about where that's placed within your facility and how that's utilized, so that people don't feel like, oh, these people are going to know that I'm the one who said this and attribute it back to me, sort of. So I think that that's a big piece of it, but in terms of just how you might evaluate the responses differently based on cultural background, I haven't any experience in that.
It's going to be a good learning. I was just going to say it's going to be a good learning session for us. So this is our first opportunity to do it this way, and we should have done it from the very beginning like this. So it'll. I don't know what we're going to get, but I think it's an important group to listen to anyway, and we should have been doing it all along.
Well, and Kevin, you mentioned that you're really kind of pushing this in some ways at the cutting edge, and that unlike what Kim was suggesting in terms of assuring anonymity, you're actually moving towards complete transparency. And I'm curious as to how you're kind of presenting that to your customers and patients and how they're feeling about it.
They've been pretty open to it, but, you know, I guess it's just like going into an Apple store or flying on Southwest. You aren't participating in an anonymous survey there, and we seem to be okay. So, you know, we tell people that we're taking a survey, and we either hand them the device or we say the device is right over there. When we put it on a pedestal, then it's going to be anonymous. But when we hand them the device, we have an opportunity to scan it and then hand off the device. I think it's just anonymous information is good. Tying to specific people is better. The more we can learn about our customers and their desires, the better we can serve them. So I'm a fan of bringing it all out. You know, and our survey scores are posted on Hospital Compare. And I'll just tell you one thing. We had a bad service incident at one of our facilities, at one of our hospitals, and the TV station came out and did a story on us. And I calculated their ratings. They get overnight ratings, so I know exactly how many people saw it. And then the TV station posted it on their Facebook page. And then people started posting comments on that Facebook page. So as it moved from wall to wall to wall, it took 2 days for the number of people who saw it on their Facebook walls exceeded the number of people who saw it on the 10 o'clock news. So we're quickly moving into an area where we're transparent already, and people are already talking about how they're treated and when they interact with us. And it's just we just need to do a better job of knowing what they're saying and knowing how well we're doing so we can improve.
Yeah. And I think the bigger piece and sort of the anonymity piece of deploying this, and even with the CMS surveys, you're able to tie it back to the individual patient. But there is something about, you know, you don't want to be sitting across from your doctor or nurse while you fill out a survey about them personally. If it's going into a feedback system where it's going to be tabulated and it's going to somebody elsewhere, I think people have a different level of comfort than if they know they're handing a card back to the person who they're going to see the next time they come through the ER, for example. So that's just a piece to consider in terms of how you deploy this. But I agree with Kevin. It's great when you have the ability to tie it back to an individual, because that's really what enables you to do some of this root cause analysis and follow-up.
Well, I'm not seeing any other questions. This has been a great session. Actually, Kevin, can I ask you to hand me the slides back so I can just post where the recording will be?
Sure.
And so just so that folks know, we will be posting the PDF of the slides from today's presentation and the recording on our website at this location. It should be up by next week. And I just really want to thank the two of you for really, I think, a very not only interesting and compelling, but I would argue for many of us challenging presentation in terms of thinking about how are we really going to learn from and engage the patients and customers that we serve and really try to do that in a much more meaningful rather than a kind of perfunctory standard survey way. And I think your experience with NPS and the larger industry experiences have a lot to teach us. So thank you.
Thank you. I hope it's been helpful.
Take care, and happy holidays, everyone.
Happy holidays.
Bye-bye.